Thank you for joining us on Health and Wellness. Today we'll be looking at amyotrophic lateral sclerosis, ALS, and also we'll be speaking with Alyssa Brownlee from the ALS organization that will be shedding some light on the ALS Foundation. Stay with us as we look on these issues and more on the other side of this break.
All voluntary movement in the body is controlled by the brain. Nerve cells in the brain, called upper motor neurons, initiate movement through the release of chemical signals called neurotransmitters. The signal is passed from the upper motor neurons to the lower motor neurons of the spine. Nerve fibers extending from the spine, called axons, extend into the muscles. The point where the axons and muscle fibers connect is called the neuromuscular junction. When the signal reaches the neuromuscular junction, it causes the muscle to contract, resulting in voluntary muscle movement. Amyotrophic lateral sclerosis, ALS, often called Lou Gehrig's disease, is a degenerative disease of both the upper and lower motor neurons. As more and more motor neurons become affected, they are unable to send signals for movement to the muscles. Loss of voluntary muscle movement and coordination develop. Over time, muscle weakness and spasticity develop. Patients are unable to perform routine activities, such as walking and getting out of a chair. Eventually, paralysis develops, interfering with the ability to swallow, talk, and breathe. Unfortunately, there is no cure for ALS. Death from amyotrophic lateral sclerosis usually occurs within 3 to 5 years from diagnosis.
The ALS organization is leading the fight to treat and cure ALS through global research and nationwide advocacy, while also empowering people with Lou Gehrig's disease and their families to live fuller lives by providing them with compassionate care and support. One such person within the ALS organization is Alyssa Brownlee. She is the clinical manager of Assistive Technology Services at the ALS Association Greater Philadelphia chapter and Assistive Technology Consultant to the National ALS Association. She has been with the chapter since 1996 and for the past 14 years have seen assistive technology significantly improve the lives of those living with ALS. Technology has continued to change and morph as the years pass, and now people with the disabilities have many choices that can help them communicate. Welcome to the program, Alyssa.
Thank you, Roseanne. It's a pleasure to be here.
Tell us, what is assistive technology?
Assistive technology is any device, whether commercially available or modified, that will help a person with a disability do something that they could not normally do.
Okay.
So, for example, mainstream devices that can be considered assistive technology would be like a reacher for those that have arthritis or who do not have the arm strength or the arm movement to pick something up.
Right.
It can be as complex as a power wheelchair or a communication device. Any type of technology, even if it's very low end, that can help a person with a disability.
Okay, fantastic. And what are some of the communications devices that are mostly used by ALS patients?
Well, it does depend on where the disease started, and then it depends on what the individual would like to do.
Okay.
So, for example, there are basically two different types of onset of ALS. You have limb onset, where it would start in an arm or a leg, and then you have bulbar onset, where the disease settles in the muscles of the swallowing and the speech.
Right.
So people with bulbar onset ALS are ambulatory, meaning they're walking around, but they can't speak.
Right.
So they often want something more lightweight, like a
Okay.
smartphone or an iPad. Whereas if you're in a wheelchair and you want the device mounted to your wheelchair because you're no longer walking, well, then you can have a heavier device.
Okay. How do you recommend a particular device? Is it at the stage at which the patient is at, or how do you do that?
Basically, through a whole assessment process. Our goal as assistive technology practitioners and those that do assistive technology, which would be speech therapists or occupational therapists, we ask the individual with the disability, what is it that you want to do?
Right.
If they want to be able to communicate and get on the internet and send an email, then we know what type of device we're looking for. And then we take in all kinds of different factors. Are they walking? What is their cognitive status? How is their vision?
Okay.
So really, it's a whole assessment process trying to match the devices to what the user's goal is.
Okay. Do you take in consideration, will this patient family can afford this device?
Correct. So there are many mainstream devices that now can be accessible for people with disabilities.
Okay.
When I started in what seems like the dinosaur age of 1996, we were still using devices that were running in MS-DOS. They weren't even running in Windows.
Right.
So now we've seen this explosion of technology, and that now we can take mainstream technology like the iPad, and we can make the iPad accessible without having to use your hands.
Right.
And that's only been since September that we've been able to do that. So then we have other people who can take an Android tablet that you can buy for $300, $400, and put at the bottom an eye gaze recognition system. Now, that is more expensive. That's like almost $2,000. But for $2,500, you have an eye gaze system. And for those that might have watched the Super Bowl the other day, Microsoft did a commercial on eye gaze technology that featured a person with ALS using a Microsoft tablet with his eyes.
Nice.
So the premise is that when you move your eyes around the screen, you dwell on a letter, and that letter is typed for you.
Oh,
so the only thing you have to do is move your eyes.
Wow. That's extremely helpful, especially for those persons who lost control of using their hands and so forth. Beautiful. Are some of these apps free, or all of them are free?
No, not all of them. And if I'm working with a client, especially with ALS, which does not often affect language, we know that that person has come to us with language intact. So basically what they need is a type and talk system.
Okay.
So there are free softwares that you can download into your laptop that will turn a laptop or a Mac into a communication device. Whatever you type into it, it comes out in a synthesized voice. If you can't type, there are other mechanisms to access computers now. So a lot of that software is free.
Right.
And then when it comes to the Android and the iPad apps, a lot of them are either free or low cost. So some of the communication apps are hundreds of dollars, but not if somebody with ALS comes to us, they don't necessarily need all the bells and whistles on those apps unless there's a secondary learning problem or language disability. So we have apps that are free that can be downloaded, and then ones that are like $2. So you don't need to spend a lot of money to make a commercially available product into a communication device for an individual with a disability.
That's really, really, really helpful, because we know that treating any illness or disease is not cheap. It's expensive. So
Exactly.
Yes. Yeah.
And when we talk about what does the individual want to do, that's why we ask, what is your goal?
Right.
Some people just want to use a pen and paper.
Okay.
That's fine with me. or they use a whiteboard. I'm the technologist that embraces all types of technology, and it could just be a pen and paper.
Right.
But, we always encourage people to have low technology items available. Like this is a standard letterboard.
Okay.
All right. This letterboard I can get for individuals with ALS in up to 21 different languages.
Nice.
So, for example, if I go to the front page, you can see here that there's pictures, and this happens to be a Spanish board. So in this picture, it says suction in English, suction in Spanish, and a picture. So that if I was trying to speak to a Spanish-speaking only person, I can have him point to what he wants, and there's no confusion because he sees it in his language, I see it in my language. Then if they can't point, you can use something called partner-assisted scanning. So if I was in the hospital, or if I'm in the ER, and I'm trying to tell the doctors I have something to say,
right.
90% of the time you're not going to have a device with you, even if you own a device. So you do something called partner-assisted scanning, where you say, okay, is it this row? Is it this row? And if they nod their head, give me a thumbs up, whatever our agreed signal is, I say, okay, is it this one, this one? Oh, you want the nurse.
Right.
Got it.
Nice.
So there's no breakdown. You don't have to be able to point to use low technology.
Okay.
And then you could even point something out. You can spell things out if you needed to. So these come in a variety, as I said, of different languages. And we always tell people to have one of these available. You never know if you're going to end up in the emergency room, or you're going to end up in a situation where you don't have any way to communicate, but you would always have something available.
Okay. And that leads me to my next question. Most times at home, you have the larger communication devices. So
Correct.
Going to a healthcare clinic for your checkup, or are admitted in the hospital, what would be those communication devices that you would recommend?
I would always tell you to bring a letterboard.
Okay.
Okay. For example, if you're in the ER, you know that can be a crazy environment. Even if you're in the hospital, you might have had a procedure where you're under anesthesia and you're kind of dopey and loopy. So you would want something that's just easy to communicate with. So of course, if you had your device, that would be ideal. But it might not be ideal. And in the ICU, where if you had surgery and for some reason you were even temporarily ventilated and couldn't speak, you have access to devices or to boards like this. Or some people will make, this is a binder based on categories. So, you can have a category here, and this actually, you could always hang this next to the bed in the hospital, or from an IV pole. So you would always have your ability to communicate there. You can make, this is called a functional needs picture book, and it's all full of pictures, things that you might need. So there's lots of low technology out there, but you have to remember to bring it with you. I do recommend that everybody have a go bag. Okay. Which is a bag that would sit next to your front door, that if you had to leave, for example, to go to the ER, or if you had to leave because of a natural emergency, that you have a bag next to you and next to the door that has, immediate communication in it, that has a list of your medications and any other pertinent things you need to bring. For example, a lot of folks with ALS end up using a feeding tube. So you have a couple of cans of feed in the go bag. So that you always know that if you have to leave in the event of an emergency, you have something with you. Now, for example, today I'm in Philadelphia, and we're in the midst of a huge ice storm. There's thousands, if not millions, of people without power. So my communication device is going to rely on power. Even if I charged it up, I'm going to have, a couple hours? So what am I going to do to communicate if I don't have power? I had to leave my home unexpectedly. I had 10 minutes to get out. Come on, guys, let's go. So I would always have that go bag with me to take with me, and know that I had enough materials to make it the FEMA says 7 days. I mean, I don't know how much you want to put in a bag.
Right,
It
right.
should have the most pertinent information.
Okay. And as it relates to that, do you offer training to the caregivers with the ALS patients? Because I know this is a lot of information for viewers who are watching. They want to know, how can I get training to better help the patient?
If they're in the U.S., I always encourage people to contact your local ALS association. Almost every state has an ALS association that helps people within the state, or like my local association, we cover 3 states.
Right.
So you could certainly start with your local ALS association if the person has ALS.
Right.
There are other disabled or disability-related agencies that will certainly help you. Yes. If it's a simple question of how to use a letterboard, they can email me. I'm happy to help.
Okay.
I also do a lot of Skyping with people with ALS and their caregivers to even just teach them how to do what I just showed you, which is partner-assisted scanning. So, we're doing a lot more tele-rehab, and that is certainly an option for individuals too.
Okay. And for the persons who are from the Caribbean region, like Jamaica, who wants to get access to information, to training, to different stuff that they don't have a local chapter as here, but they'll have a practitioner in the hospital itself. How can they get in contact with you to get
with me? They can send me an email. My email is abrownlee, so it's BROWNLEE at ALSA, ALSA-national.org.
Right.
I'm a Twitterholic, so I'm on Twitter all the time.
Okay.
I also have an ALS Facebook page where people contact me for information.
Right.
So with a variety of different methods, I'm always available to help people.
Okay. For persons, and I'm going to refer back to Jamaica, who wants to do a consultation, they're in Jamaica, would they be able to do a consultation with you here before taking the trip here?
Oh, certainly, yes.
Okay.
I would encourage that.
Okay.
Because it helps us know a little bit about the individual.
Right.
And, it might be sometimes the most questions that I get are simple questions of, oh, I didn't think of that.
Okay.
And a lot of what I've learned after 18 years with this chapter has been that my caregivers have been the one educating me. This is what I've tried. This is what works. And I also know that when it comes to people with ALS, we have points in the house that often create the most problems and arguments.
Okay.
And the number 1 place is the bathroom. Okay.
Wow. Okay.
The number 2 place is in bed.
Okay.
And number 3 is often when they're being transferred from bed to wheelchair or something. And all of those are oftentimes because of positioning. So, for example, if I was trying to toilet someone with ALS, a lot of times their muscles are weak in their trunk. So they're kind of bent in upon themselves and their head is hanging down. Well, that's a very hard way to try to communicate with someone.
Right.
Okay, and in bed it's the same way, but they're laying down, they don't have a lot of breath support. So what I try to do is ask the people, what issues are you having and where in the house?
Right.
So that we're going to have a communication system for the bathroom.
Okay.
We're going to have a different one for the bedroom.
Okay.
We're going to have a different one for the living room, because we know through studies that most people with ALS use multiple modalities of communication depending on where they are.
Right.
So there isn't one set device, there's not one set system, because I get that a lot. I'm fortunate to be part of the certified center at the ALS Association sponsors at Pennsylvania Hospital, and I've been going there for 12 or 14 years. And so a lot of times what I hear are these trigger issues.
Right.
And if somebody is still speaking, ALS causes dysarthria, which is slurred speech.
Right.
So if somebody is still speaking, we know that the more they get upset, the worse their voice gets.
Right.
So when they're getting angry or they're upset that nobody can understand them, their voice is getting worse. And so it's almost like a spinning wheel that is not going to have a solution until you say, okay, we've tried this, 3 times. Now I'm going to get the letter board, and you're going to just tell me the first letter of what you're trying to say.
Right. And just before we wrap up this interview, we have covered a wide range of what to expect and what to use for ALS. But there are persons out there, as we know, ALS is one of those diseases that is hard to diagnose. But persons out there who they're not sure as to what the symptoms, their experiences are. What are some of those signs to look for as it relates to ALS?
It does depend on where the disease has settled. So, for example, people who have the bulbar onset ALS, which starts here and here,
right.
Will often come to our clinic being diagnosed with a stroke.
Right.
And they've been treated with a stroke because their voice has been slurred
right.
For many months until their neurologist says, I think there's something else going on.
Oh, wow.
And then if it's a limb onset, it will often be like a foot drop, they're tripping,
right.
or they might tell us that they're weak in the arms. So there is no definitive test to diagnose ALS.
Okay.
Basically, a neurologist has to rule out every other disease under the sun.
How long does that diagnosis take in terms of try to diagnose that illness?
The statistical average is 9 months to diagnose.
Wow.
And then ALS has no cause and no cure. So the statistics say that after diagnosis, people with limb onset have a 2 to 5 year lifespan. And people with bulbar onset have an 18-month lifespan.
Wow.
Now, of course, those are only averages.
Right.
And we have some folks with ALS that live, I think it's 10% that
right.
live 20 years or more. So we don't know because the disease progresses differently in every individual. But there is not a cause that we know of. So we know that 90% of people with ALS have what they call sporadic ALS.
Right.
We don't know why they get it.
Wow.
But 5 to 10% have a genetic component.
Right.
And so that is a statistic where if one of the parents is carriers, the statistical average is 1 out of 4 children
right.
will get ALS.
Wow. And as we wrap up, and I'm sure our viewers are just tuned into the interview. But as we wrap up today, the last thing that I want you to leave with the viewers, what would be your recommendation should be the first response when they found out that they're having those symptoms, as you just explained? What would be their first response?
Their first response is try to find a neurologist that is well-versed in the disease.
Right.
That is the most important thing. There are many, many decisions that they need to make. And they need someone who understands the disease,
right.
who can understand the progression of the disease and help
right.
them make decisions based on what their trajectory is. Because there are many decisions, and a lot of them are quality of life decisions.
Right. Wow. Wow. So I just want to thank you, Alyssa, for being with us today. And I want to thank the organization for the work that they have been doing
thank you.
To just bring awareness to ALS. Thank you so much.
We are trying. Thank you.
You're most welcome. And stay with us as... More on ALS. There are facts you should know about ALS that could change one's life. You need to know that ALS is not contagious. It is estimated that ALS is responsible for nearly 2 deaths per 100,000 population annually. Although the life expectancy of an ALS patient averages between 2 to 5 years from the time of diagnosis, this disease is variable and many people live with quality life for 5 years and more. More than half of all patients live more than 3 years after diagnosis. About 20% of people with ALS live 5 years or more, and up to 10% will survive more than 10 years, and 5% will live 20 years. There are people in whom ALS has stopped progressing, and a small number of people in whom the symptoms of ALS reversed. ALS occurs throughout the world with no racial, ethnic, or socioeconomic boundaries. ALS can strike anyone. The onset of ALS is insidious, with muscle weaknesses or stiffness as early symptoms, progression of weakness, wasting, and paralysis of the muscle of the limbs and trunk, as well as those that control vital functions such as speech, swallowing, and later breathing generally follows. There can be significant cost for medical care, equipment, and home health caregiving later in the disease. It is important to be knowledgeable about your health plan coverage and other programs for which you may be eligible for. While there is not a cure or treatment today that halts or reverses ALS, there is one FDA-approved drug, Relazole, that modestly slows the progression of ALS, as well as several other drugs in clinical trials that hold promise. Importantly, there are significant devices and therapies that can manage the symptoms of ALS that help people maintain as much independence as possible and prolong survival. It is important to remember that ALS is a quite variable disease. No two people will have the same journey or experiences. There are medical documented cases of people in whom ALS burns out, stops progressing, or progresses at a very slow rate. No matter what your individual course or situation may be, the ALS Association and your medical team are here to help. For further information on ALS, go to the ALS organization website at alsa.org. That's our show for today. Join us next time as we offer to you hope, the possibility of prevention, cure, and sustainability in health and wellness. On behalf of the entire production team, I'm Roseanne wishing you